Eczema is different from a fungal infection, is different from acne, is different from hives. They are so different. Hi guys, welcome back to a brand new video. If you're new to my channel, you're very welcome. My name is Busola. I am a medical doctor living in Lagos, Nigeria. I make medicine and lifestyle content. If you've not subscribed, please hit that subscribe button right now and check out all my other videos. I am sure you would absolutely enjoy them. In today's video, I'm going to be talking about common skin conditions that you may have, what causes it, and how you can get rid of it. I realize that a lot of people have this issue. I get a lot of people DMing me. Once you're a doctor, people just randomly, strangers just randomly send you messages with their health concerns, and they expect you to respond and answer them and tell them how to treat it. One of the most common complaints that I've seen that a lot of people have, even from my job working in an outpatient department where I see all kinds of patients with minor complaints, skin conditions are very common in them. It can be quite distressing, it can be very confusing for a lot of people, and I realize that there's also a lot of misinformation with a lot of these skin conditions. So we're going to be talking about that and just elaborating on it and educating ourselves on these common ones. Okay, an important disclaimer: this should not substitute for your doctor's advice or your medical advice. You should still, if you have any medical or health complaints, you should still go to the hospital so that you can be properly treated. I cannot see exactly what it is. You may have misdiagnosed yourself if you don't have experience. Okay, if you are not a dermatologist, you are not a doctor, you can easily misdiagnose yourself. So this does not substitute for a consultation with an actual doctor physically to be able to see, test, examine, and adequately treat you. Okay, let me just put that out there. Since that is sorted, let us jump straight into the video. The problem that I see a lot is a lot of people misdiagnose themselves, and it is widely accepted. Eczema is different from a fungal infection, is different from acne, is different from hyperpigmentation, is different from hives. They are so different. If you think that you have something and what you have is something different, the treatment you are going to give it is not going to work because you are not treating the condition. The major misconception I see among Nigerians when it comes to skin issues has to be between eczema and pityriasis versicolor, which is a fungal infection. Eczema is different from pityriasis versicolor. Pityriasis versicolor, I'm going to leave a picture here so that you guys can actually compare and see what they both look like. Pityriasis versicolor is a fungal infection, while eczema is an inflammation of the skin. Okay, the skin is inflamed, the skin is reacting to something, and it comes off looking dry and flaky and sometimes itchy. They are two different things and they look different. For some reason, people mistake eczema for pityriasis versicolor and vice versa. Okay, a lot of people that have pityriasis, they think it's eczema, and because of that they usually keep treating it with steroids, like steroid creams, which would not work for pityriasis versicolor. Okay, that would only work for eczema. So let's start with eczema. And eczema is dryness, patchiness in the skin that sometimes come off itchy. It is usually caused when your skin reacts to allergens or irritants. There are certain things that can make your skin flare up in eczema, and there are some certain people that are more predisposed to it. People that generally have allergies, that have sensitive sinuses, airways, asthma, generally allergies or atopy, would be more predisposed to eczema than the general population. So first things first, is it contagious? No, it is not contagious, but it can be hereditary. Eczema does have some genetic or hereditary components. So if your sister or your mom or your dad has eczema, then it is very possible that you also could develop eczema. So how do you treat it? It depends on the degree of your eczema. For mild cases, you are generally advised to moisturize your skin, use emollients. Those are creams that help lock in moisture, because the most important thing that is happening to your skin is that it is irritated, it is inflamed, and so it is dry. Okay, it is dry, it is itchy, it is patchy, and so using emollients, things that or creams that lock in moisture for a long time helps a lot with eczema. However, depending on the degree of the eczema, if it is quite advanced or more serious than a mild one, if it is the moderate or the severe kind of eczema, then you may be prescribed topical steroids. Those are steroid creams like hydrocortisone with low percentage, not very high percentage hydrocortisone, but low percentage hydrocortisone. And I always advise people to not misuse hydrocortisone or any other steroid cream, because it could also have adverse effects on your skin, because these creams are actually steroids. It is not advisable for you to just randomly go and get a random one and start using. You start with a very low dose, low concentration, and you don't use long term. Okay, you don't keep using it till eternity. Moving to pityriasis versicolor, seen very commonly in people, and it usually looks like this. Usually you will see that the areas of skin affected, they are lighter than your actual complexion, and it's like patches, just small patches, depending on how severe it is. It could be large patches, it could be small patches, and it is very common on the chest, on the back, the shoulders, and sometimes even the face. This is a fungal infection. It is caused by tinea versicolor, which normally it is a natural fungus that grows on the skin. But if anything happens to the skin or to your body that makes that fungus overgrow, then you start having pityriasis versicolor. You start having that thing that people call ifo, right? And then you start having the hypopigmentation. It could be itchy as well. Another misconception that I see a lot of people get with this is that it is contagious. It is not contagious, and it is usually not due to poor hygiene. The things that can cause you to have pityriasis versicolor are excessive moisture. You are in a very humid environment. Fungus grows or they thrive in humid environments, very hot weather, if your immunity is low. So things like being pregnant, having diabetes, using some certain drugs that will reduce your immunity can predispose you to also having pityriasis versicolor. How do you treat it? The way to treat it, because it's a fungus, is to use antifungal drugs, antifungal medication. Some antifungal medication come in forms of creams, so you can use that all over the area that is affected, and that usually works very well for it. However, there are some cases that can be resistant, that just the topical one would not work for it, and you have to actually use a systemic antifungal, which is in form of a tablet that you would swallow as well, to help kill or reduce the fungal overgrowth and help tame this condition. Speaking of fungal skin infections, another skin infection that fungus or fungi can cause is the tinea, the different types of tinea infections. Depending on the location, the tinea capitis on the head or the scalp, tinea corporis on your body, tinea cruris usually around your groin or your genital area in between your toes, and you call that tinea pedis. Basically anywhere that has fold or that can retain moisture in your body are areas that are at risk of getting fungal infections. A lot of people, they come in with itchy, like they see that under their bust or under their breast is very itchy. It can be whitish, sometimes it can be dark, very itchy. Sometimes it can get inflamed as well, it can get red. It is usually due to a fungal infection. It is a tinea infection, what we call ringworm. It is round, it is scaly, it is itchy. All of these infections are under one entity. It just develops in different areas of the body. This particular fungal infection can be transmitted from one person to the other. To treat it, antifungal creams or medication. You have different types of antifungal medication and different reasons why you use them. Seborrheic dermatitis usually affects the scalp and the face. It causes dryness, itchiness, scaliness, flakiness of the scalp, what a lot of people present with as dandruff. If you notice that your scalp is really itchy and really flaky, you probably have seborrheic dermatitis. One of the major causes of seborrheic dermatitis is yeast infection as well. Your skin is reacting or responding to the presence of yeast or fungus on the skin. You see that once you itch, whitish particles just start dropping from your scalp. It can be quite embarrassing, guys. I have it, okay? It is something that I am plagued with. You can treat this over the counter by using soaps or creams that contain zinc or tar. The Heads and Shoulders is a very good shampoo that can help tame this reaction or inflammation of your scalp, to help tame the flakiness and the dryness. Also, it is very important to moisturize your scalp so that it is not as dry as it will normally be. So moisture is very important. A last resort to also be used can be antifungal medication. Like I said, the cause sometimes is because your skin is reacting to fungus or yeast on the scalp. So if you use antifungal medication to help kill the yeast, then your skin would stop reacting in that way. Common thing that we see, I would not call it a condition because usually it is not harmful and it usually doesn't pose any health risks or dangers, would be freckles, moles, or skin tags. They are quite similar and they are just like brothers or cousins, if you may. They are hyperpigmented skin growths. That means they are darker than your normal condition. However, freckles are actually not growths. Usually freckles are the same level of your skin. They usually don't grow outside of your skin. It causes a pigmentation as well. It doesn't pose any health risk. It is common on areas that are exposed to the sun as well. So you would see it usually on your face, on your cheeks, on your shoulders as well. Then you have the moles as well. Moles are outgrowths from your skin. Both moles and tags are your skin growing outside of the normal level of your skin. It just grows out and it is usually not harmful. Now, the harm there is that sometimes moles can turn cancerous. It can become a malignant tumor. It can become a cancer. And there are ways for you to suspect if a particular mole that you have may be turning cancerous. Like I said, may. It doesn't mean that if all of these things are present, then 100% your mole has turned cancerous, but it is a pointer for you to go to the hospital and get it checked out. If the mole is not symmetric anymore, if one side of the mole is growing bigger than the other, if it has a weird irregular shape, usually moles are regularly shaped, okay? It is just like a normal regular, maybe semicircular shape. But if one side starts growing weird, it starts growing wonky, then you want to get it checked out. If the color starts changing, then you should get it checked out. If it starts becoming painful, moles are usually not painful, so if you start feeling pain, get it checked out. Also, if it starts growing really fast, you've had this mole for the past 10 years and it has pretty much stayed the same size or grown very slowly, and now it has doubled in size in the past 2 months, then you should get it checked out. These are signs that your mole may be becoming cancerous or having malignant changes. So you want to immediately go to your doctor. Usually they would examine it, excise it, and go and do a biopsy to be sure that it has not turned cancerous. So hives or urticaria. This also is caused by allergic reactions. People who have allergies, people whose skin reacts to things, food, creams, certain animals, certain substances, develop hives or urticaria. Once you are exposed to that trigger, to that allergen, when they say someone's skin breaks out in hives, that is what this is what it looks like, and will usually resolve by itself if the trigger or the allergen is withdrawn. If you remove yourself from the trigger, from the allergen, from the substance that triggered that hypersensitivity, then it usually resolves. This is also non-contagious, and to treat it you just need to use your antihistamines. People who have a lot of allergies, usually they are very conversant with what these drugs are. They are drugs that help tame allergies. So next we have acne and hyperpigmentation. These usually go hand in hand, okay? They are usually like 5 and 6. After you've had acne, then hyperpigmentation usually follows. And a lot of us, majority of the population, have acne because we all have hormones. You don't see acne in children because at that point they've not undergone puberty and their hormones are not raging. But once you start entering puberty and you start having all these hormones, then you start seeing acne. For some people it is very mild. For example, me, I don't really have acne per se, but for some people it can be very, very serious. It's usually caused by the skin's pores clogging up. When your pores are blocked, then you are more predisposed to having acne, and different things can cause your pores to be blocked. Excessive sebum production. Sebum is an important oily substance that your skin produces. It is very important. It is very, very useful for the skin. However, if it is produced excessively due to hormonal changes or hormonal reasons or certain other reasons, and have it clog up your skin, and then you can develop acne or pimples from there. So how do you treat acne? The treatment of acne is long-term and constant. Your lifestyle needs to change. The food that you eat needs to change if you are predisposed to hormonal acne. Foods that are high in sugar and are processed, you want to cut all those out. Fizzy drinks, processed foods, processed carbs, you need to stop them. You need to stop them or reduce them to help tame the acne. You want to be sure that you are cleansing your skin properly so that it is not clogged. You want to use good cleansing face washes for your skin. A lot of people recommend double cleansing to make sure that everything that your face touches is clean. Hands have to be clean before you touch your face. Your bed sheets, your pillowcase must be clean. You should change your pillowcases at least twice in a week to be sure that you are not exposing your skin to germs that will make your skin react and break out in pimples or acne. Then moving to products, there are different products that help tame acne as well, and the most important one, the only one that I'm going to talk about, has to be retinoids. Retinol, tretinoin, adapalene. Different ranges of retinoids are out there and different strengths as well, depending on the level of your acne and what you are really trying to achieve with it. Retinoids are scientifically proven to work, and they help to increase the skin turnover, which would help to remove the dead skin cells, the gunk on your face, to help your skin look glowy and fresh, even apart from preventing getting acne. The thing I see that a lot of people complain about when they start using retinoids is that their skin purges. So because of that, it may seem like your acne is getting worse, and usually a lot of people just stop after that. But the first step, especially if you have really bad acne, your skin to purge, your skin is going to react to the retinoids. You keep at it, your skin is going to thank you for it. Before you start any retinoids, you should do your research properly to know how to use it, how much to use, when to use it, and what products to use alongside it. For example, you don't have any business using retinoids if you are not going to use sunscreen. Your skin is going to burn. You have to be sure that you are adequately protecting your skin from the sun if you are using any retinoid products. Now moving to hyperpigmentation, like I said, acne and hyperpigmentation, they go hand in hand. After you've had an acne, usually it will get darker and you start seeing it as an hyperpigmented or hyperpigmentation spot, which can be equally as annoying as the acne itself because it takes a while to clear out. And there are certain products that you can use for this. You should do your research, but the products that I use that I think I absolutely love have to be niacinamide, vitamin C, retinoids, glycolic acid, licorice. These are some of the products that usually work to help clear your hyperpigmentation. If you are going to start skincare, if you are going to start using skincare products, you need to do your research adequately, because a lot of these active products, you can't just use them together in the same routine. It would react with each other and your skin is going to break out, your skin is going to react, your skin is going to be inflamed. So you need to know what products to use with certain products. I am not a guru when it comes to skincare. I just know what works for me from research. There are a lot of resources out there right now, but you should be sure you are not just taking advice from someone who also doesn't know what they are saying. A lot of skincare influencers, a lot of estheticians are out there now now on TikTok, on YouTube, that you can really learn from. So you should do your research about that before starting any active skincare products. Last but not least is herpes. I know a lot of people don't know that this is what you call herpes. This is oral herpes. It is caused by a virus, and majority of the population have this condition. They have this herpes. It flares up when your immunity is low, and you see it as sores around your mouth or on your tongue. This is called the oral herpes. Yes, it is transmissible, and usually people get it from kissing. So they say don't kiss babies, because if you have it and you kiss a baby, you can infect that baby. The condition is more severe in them. There's a name Yoruba people call it, but I can't remember currently. If I remember, I'll put it on the screen. And a lot of people link it to having malaria or falling sick, and they will not be wrong, because when you are sick, your immunity is low, because your immune system is trying to fight that sickness, so your immunity becomes low, and so because of that you flare up again and you have this herpes. So how do you treat it? I'm sure a lot of people have had this, and you'd realize that it goes by itself. Within a week, the infection clears out and the flare reduces, and then it just disappears. During flare-ups, it's important to take healthy foods, vegetables, fruits, or vitamin C. In very rare cases, you can be given antiviral medication also to help clear it up, but usually you do not need it. You just need to give it time and eat healthy, rest. It's going to recover within a week. That brings us to the end of this video. I hope you enjoyed it. We spoke about 10 different skin conditions today. I hope that you enjoyed it and you learned something from it. If you enjoyed it, please give it a thumbs up. Let me know your thoughts in the comment section. Thank you guys so much for watching. Don't forget to be kind to yourself and be kind to others. Okay, bye.